Chronic diseases. One of the main concerns for minority seniors is a chronic health condition. Ethnic minorities have higher incidences and greater mortality from chronic illnesses. For example, African Americans and Hispanics have higher rates of diabetes, heart disease, asthma, cancer, obesity, anxiety, depression, and high blood pressure than non-Hispanic Caucasians. Hispanics are also twice as likely to die from diabetes than non-Hispanic Caucasians. The Stanford School of Medicine has compiled several ethnic-specific disease modules for additional education and information. To learn more, please click the Attachments tab and select Ethnic-Specific Geriatric Care in the USA. When first meeting a minority elderly person, you may need to take an assessment of the person's health. One of the first considerations is how well you can communicate with the senior and how well he or she understands you. If you sense that you are not being understood or feel that you cannot properly communicate with the individual, seek the help of a professional medical interpreter that speaks the same language and dialect if possible. Take time to find out about the person's ethnic background. Asking specific questions about his or her country of origin may prevent incorrect assumptions. For example, you may assume a dark-skinned person may be African American, when instead they may come from the Caribbean, Central America, or South America. Ask how much time they have spent in the United States and how much they have become accustomed to American ideas, beliefs, and values. Consider how similar or different they think from a mainstream American senior. Consider if an individual or group will make the healthcare decisions. You should assess how much impact family members or others will have in medical decision-making. In some cultures, the oldest male will make the decisions. This could be a spouse or oldest son. Other ethnic groups may choose to bring in an outside, non-biologically related person to help with decision-making. In the example of Mrs. Reyes, her whole family was active in helping her make a decision about whether to have an ultrasound. Here are some ethnic considerations when conducting a physical exam. Check to make sure the senior is comfortable with a person of the opposite sex doing the physical exam. In some cultures, it would not be appropriate for a male nurse or doctor to examine a female patient. A quick question to the individual or family members prior to the exam would easily resolve this question. Speak to the person throughout the exam and ask permission to examine more sensitive parts of the body. During the physical exam, think about how the minority senior may describe symptoms. For instance, a Chinese senior may describe symptoms of depression as having a heavy heart. Don't take it on face value. You may need to seek further explanation for his or her description. Ask questions to assess mental health and to look for signs of depression or social isolation. Keep in mind that mental illnesses or dementia are highly stigmatized in certain cultures, and you may need to ask more questions about symptoms without naming a mental illness or a specific disease. Finally, be on the lookout for signs of elder abuse. You may see signs during the physical exam, such as bruises or burns.